I'm here today with Donna, who is a women's health pelvic physio. I was referred to pelvic physio after having a birth injury, and I really didn't know what this entailed, and I've gathered some questions from mums like myself that didn't know why they had been referred to a physio, and I think this video will really come across to help understanding what your role is. The first question: what is a pelvic health physio, and how are you different to a normal physio?
Yeah, so a pelvic health physio works in all things pelvic health, and we differ from a normal physio just by our training. So all physios will go through that basic training, our undergraduate 3 years, and then when we come out of that, we might work in different specialties and decide to specialise in different areas. So you'll get some physios that work in critical care, so on intensive care. You might get some physios who work in neuro rehabilitation, so looking after people after they've had a stroke. And then we have pelvic health physios, and essentially we look after people who have had bladder issues or are having bowel issues or maybe prolapse symptoms, and we support them to manage those symptoms more effectively. We're also sometimes known as women's health physio, so that's the other title that you might see if you're referred to a professional for this type of problem.
My next question, which I know is thought of a lot, is what happens at the first appointment, and do you have to have an examination at that appointment, as that can be quite scary in itself?
Yeah, so I think when you first go to see your physio, particularly with pelvic health, I understand that might feel quite worrying, or that you might feel quite vulnerable. Essentially, your physio is there at that first point to ask you questions, to try and find out information about your pelvic health issues, to discover how those issues are impacting on your everyday activities and your everyday life. So there might be lots of questions, but they will be questions that will help to formulate plans. It will help the physio to find out what's going on and to select suitable management options for you. It is sometimes indicated for a pelvic floor examination, which does normally involve either a vaginal or an anorectal examination, depending on the symptoms that you're coming with. And that can sometimes, because of the intimate nature of that examination, can feel quite intimidating. You can feel quite vulnerable. I think it's really important to recognise that your physio will gain valid consent from you. So they should be asking for your permission to do anything that they need to do, and explaining that really clearly to you. So what is required and why it's required. If you're happy to proceed, then it will involve sort of undressing from the waist down. The examination is normally relatively comfortable, but if there are any elements of discomfort during that examination, then your physio will ask you to tell them to stop. It's really common to feel embarrassed during those examinations or when you're coming to those appointments. However, it's your physio's job to put you at ease. So we should be ensuring that you feel physically and psychologically comfortable. If you want somebody with you in your appointment, you can absolutely bring them with you. That's not a problem. One thing that's probably worth mentioning is there are some trusts, some departments where there may be a requirement for a professional chaperone, so another member of staff to be present during that examination. If you're not happy with that, you need to have that discussion with your physio, and there may be room for manoeuvre on that, and you will probably be offered a chaperone if there isn't one already present. So it's important that you do what you feel comfortable with at the time.
I have bowel issues, and I was under the impression that the pelvic physio would just deal with urinary issues, but you deal with everything, don't you?
Yeah, so we deal with a whole host of issues. So yes, urinary, absolutely. I think we talk about that a little bit more. So I think the conversation of urinary issues is coming up in general daily conversation a little bit more than it used to. So yes, we can help with bladder dysfunction, so urinary incontinence or urinary leaks. We can discuss other bladder issues like going to the toilet too much or needing to rush when you need a wee. But we can also deal with bowel issues as well. So if somebody again is needing to rush when they need the toilet, so they're urgent when they get a bowel urge, or if they leak from the back passage, whether that's wind or whether that's feces or poo, or whether they're experiencing prolapse symptoms, so that heaviness, that dragging sensation down below, and even some issues with sexual function, so pain during intercourse, things like that, your pelvic health physio might be able to help you with those as well.
Another question is, can someone just try and do their own pelvic floor exercises at home? You can find them on the internet, or could they be doing them wrong and therefore they need to come and see someone like you to get a proper program?
Yeah, so you absolutely can do them at home, and certainly I'd encourage everybody to try, because they're a really important part of postnatal recovery and of rehabilitation when you're having bladder and bowel issues. But what I would say is, if you're doing your pelvic floor exercises at home and your symptoms are worsening or they're not improving, then that gold standard should be a referral to your pelvic health physio so that they can do a pelvic floor examination with you. They'll be able to check your technique, so they'll be able to check that you're doing your pelvic floor exercises properly. They'll be able to guide what position you should do those exercises in, and they'll be able to guide how long you should be holding for, how many repetitions you should be doing. So they'll be really able to guide that strength training really, really well, compared to doing the standard 10 lots of 10 that you normally see on the internet.
Also, why might someone be referred to a pelvic physio after they've had a baby is a question that does come up quite a lot.
If you've had a large tear, so a 3rd or a 4th degree tear during the birth of your baby, we would always recommend that you see a physio. This enables you to have your pelvic floor assessed. It enables you to discuss any symptoms that you might be experiencing, and gives us the opportunity to explain to you why you might be experiencing some of those symptoms, which I think is really, really important. However, if you're experiencing any symptoms of pelvic floor dysfunction, so incontinence of the bladder, incontinence of the bowel, prolapse symptoms, sexual dysfunction, anything that doesn't feel quite right, your pelvic floor physio, your pelvic health physio should be able to support you with that. Or if you've tried your pelvic floor exercises and you think, oh, I haven't got a clue what I'm doing here, that's a really good opportunity to say, actually, I'm going to go and see the pelvic floor physio. They can do their examination, and hopefully I'll be able to then do my pelvic floor exercises correctly and reduce the risk of there being problems further on down the line.
So what treatment plan or management can you offer someone that has come to you straight after having a baby and they need some help?
Yeah, so it's really variable. So it really depends on what your physio finds when they do their assessment with you. It might be some bog standard pelvic floor training, so just going through your pelvic floor exercises, improving the strength, so doing strength training, load training, functional training. That might be enough, but there are lots of adjuncts that we can also use. So your vaginal stimulators that can sometimes help if the pelvic floor is on the weaker side, or if you need support relaxing that pelvic floor, that feedback can be quite useful. And there are lots, and like I said, there are lots there's a lot of variety of management strategies that your pelvic health physio will be able to discuss with you, depending on what symptoms you're presenting with.
Another question that's asked quite a lot, if you've had a cesarean section, do you still need to come and see someone like yourself, and can you still have issues with your pelvic floor?
Yes is the answer to that question. So following a cesarean, you can still have issues with your pelvic floor. I think it's really important that you access support if you're symptomatic, no matter what type of birth you've had. We know that there are some increased risks associated with vaginal birth, so particularly your forceps births, or if you've had a larger tear. But essentially, the pelvic floor dysfunction can be caused by the pregnancy itself because of that increased load for a prolonged amount of time. So actually, if you've had a cesarean and you're experiencing issues, or you're not sure about how to do your pelvic floor exercises, then a referral to your pelvic health physio is still absolutely indicated.
And finally, Donna, how can someone get a referral to a pelvic health physio?
If you're experiencing symptoms of pelvic floor dysfunction, then I would strongly recommend that you go and speak to your GP. They should know about the local pathways to access your physiotherapy services. If you've recently had a baby, you might be able to discuss that with your midwife either, and they might be able to give you some information about how to access physiotherapy. And I think it's really important that if you are experiencing symptoms, that you do go and see somebody and speak to someone. It can be really miserable living with these symptoms and with these conditions, and your pelvic health physio may well be able to help you with that and really improve your quality of life. So go and speak to your GP, go and speak to your midwife, get your referral, and come along, and hopefully we'll be able to help you with your recovery.
That's brilliant, Donna. So when I was referred to a pelvic physio, I did not know what was going to happen and how they could help me. They really are worth their weight in gold. So thank you for answering those questions and helping new mums.
You're welcome. Thank you.